Ebola outbreak is still continuing.
Ebola has now become a part of the world.
We are up against a really, really big challenge.
We're doing everything we possibly can.
Folks are still in stages of fear and denial.
I do not believe that West Africa can or should be abandoned. We need to stay engaged.
Good news doesn't mean we stop. It means that we remain more vigilant.
As staff of Samaritan Press, we go where nobody dared to go.
We come back because we care, and we come back because we have a calling.
The people of Liberia need mercy.
This is such a terrifying and traumatizing time for Liberian people, and we can't neglect to give them hope.
Samaritan's Purse has been in Liberia since 2004.
And it's become home for us, and the people that we get to interact with our projects are very, very special to us.
Early on in the outbreak, we, Samaritan's Purse, were situated in the northwest of the country, and so we had to engage.
We decided that the best response that we could have was giving public awareness education.
A decision was made to set up an Ebola treatment unit in the northwest in Foya. Doctors Without Borders set it up.
But then by the end of June, new cases started erupting.
It soon became evident that it was going to become a situation that was not controllable. Doctors Without Borders realized that they didn't have personnel to handle the situation. At that point, they approached Samaritan's Purse and asked if we would engage clinically.
That was a major step forward for us strategically.
I remember Kendall saying when we took over the Foya Ebola treatment unit, part of being Samaritan's Purse, as a good Samaritan, we didn't walk away. We got down in the ditch, and we have a responsibility not only to uphold it in our name, but because we have been in Foya in this area for 8 years. These are our people. This is like family being sick.
And very soon, we started hearing news about how the outbreak had come into Monrovia.
We had doctors in the country that were working with Elwa Hospital.
Eternal Love Winning Africa, Elwa's hospital, has been a mission hospital for almost 57 years, and Samaritan's Purse has been involved with them in many different ways. We've also been very involved in providing volunteer doctors and nurses.
Hi, I'm Dr. Kent Brantley.
Kent Brantley was in our post-residency program through World Medical Mission. He was stationed at Elwa. They began to make preparations.
We converted our small chapel where we held daily staff devotionals into a 5-bed isolation unit.
That soon was full. Then we built a second unit with 20 beds. That soon was full.
That's when I started thinking about, wow, this is becoming massive.
Breaking news, President Obama getting briefed on a deadly Ebola outbreak. A second American is now tested positive for the virus.
The conditions of 2 of their American volunteers in Liberia, Dr. Kent Brantley and Nancy Wright-Bull, are deteriorating.
The international response to the disease has been a failure. It was not until July the 26th when Kent Brantley and Nancy Wright-Bull were confirmed positive that the world sat up and paid attention.
We stopped everything because our focus now was how do we get Dr. Brantley home.
The 2 American missionaries stricken with the disease are being medevaced home.
And the clock is ticking.
Tonight, a U.S. medevac plane is racing to Liberia to start evacuating American missionaries stricken with Ebola.
Kent walked up onto the Phoenix airplane and he flew off. That was a moment of great relief and also a moment of great anxiety because we didn't know what awaited on the other side.
Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family.
Despite the media attention, the international response was still slow.
I had the privilege and honor of meeting with President Obama this morning, and we discussed his commitment of more military and medical resources to fight this epidemic, and we need it immediately.
When Kent Brantley became sick, we did evacuate our expat staff.
We needed to go back to the drawing board and rethink. We recognized that all of the clinical capacity that we had wasn't enough. What could we do that would have the most impact?
We looked at community care centers, an interim home-based intervention, and then the continued infection protection control, the educational aspect of the Ebola response.
Behind me is a plane that is loaded with supplies and equipment to help fight Ebola.
This represents hope. We want to say Thank you a million times.
Having those two 747s come in with supplies, I believe, sent a real positive message to the government that Samaritan's Purse is still very deeply committed to Liberia.
We are training Liberians to care for Liberians. Since the spring of 2014, we have educated 1.5 million people.
As of January 31st, the outbreak has slowed tremendously. We want to be part of rebuilding the health infrastructure. Liberia lost 357 healthcare workers to the disease. The total healthcare workers before Ebola was around 800.
We've learned a lot of lessons through this.
Ebola humbled us. It didn't care who you were. It didn't care if you were a little baby. It didn't care if you were Muslim or Christian. It didn't care if you're an American doctor.
Ebola shook Samaritan's Purse.
We're such a strong group because of it. We're just all looking forward to being together again and being stronger for this great opportunity that we believe God has given us now.